Okay, we're going to go ahead and get started today. Welcome. My name is Natasha Askelson, and I'm a faculty member at the College of Public Health at the University of Iowa. And before we get started, I have a few housekeeping things that I want to go through with you. First, we're going to be recording this event, and you will receive an email after the event that has a link to the recording. We encourage you to share the recording with others in your business or your family or friends. We also encourage you to ask questions of our panelists. So if you see at the bottom of the Zoom tab, there's a Q&A button. So you can go ahead and click on that, ask your question, and we're going to gather all the questions and wait until all the panelists have presented, and then we'll ask the questions. I'd like to welcome you all to this webinar. This is a presentation that's been sponsored by the University of Iowa College of Public Health's Business Leadership Network. The Business Leadership Network is an initiative of our college to engage businesses with public health students and faculty, to better connect communities with our research, and to provide a means for business and community leaders to network with one another and share their ideas and best practices about health and wellness at the community level. We do this through a variety of formats, for example, holding forums in communities around the state. We have virtual events like this one we're having today. We also have a community grant program, which supports innovative health improvement projects in communities across Iowa. And later, we will be sending you an email to provide you some information about this grant program. We expect that the next funding cycle for it will be happening this fall, so watch out for that. We're going to begin today's program. I'll introduce each of the panelists as it's their turn to speak, and then we'll have questions and answers at the end. So the panel is going to focus on businesses and how they can encourage and support employees to get the COVID-19 vaccine, not only to keep us all healthy, but to also prevent interruptions in business operations. The first person on our panel is Dr. Pat Winokur. She will set the stage, providing us with some important information about the COVID-19 vaccine. Dr. Winokur is the Executive Dean and a Professor of Internal Medicine of Infectious Disease at the University of Iowa Carver College of Medicine. She has extensive experience in vaccine research and recently led the Pfizer clinical trials at the University of Iowa and is currently leading the Novavax trials. So thank you, Dr. Winokur, for joining us. I think you might be muted.
Thank you. So thank you for having me. It is once again another historic day in the life of COVID vaccines. As many of you keep watching the news, today we had the approval of the Pfizer vaccine for 12 to 15-year-olds, so a great milestone. As you know, we now have 3 approved, emergency use approved vaccines for COVID-19. We have the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. One of the things that is remarkable is now we have hundreds of millions of people that have been dosed with these vaccines. And that's given us a lot of opportunity to evaluate not only the safety of the vaccines, but also the efficacy out in the real world. We knew from the clinical trials, and these were huge clinical trials, that these vaccines had somewhere between 70 and 95% efficacy. But we always wonder, you know, clinical trials are not the real world. And as you start to deliver these vaccines out into the general public, you go back and you try and understand, were the studies actually replicating what we're seeing in real life? And the answer is yes. These vaccines have continued to be extremely effective out in the real world. So that's great news. We do have, again, today's news, now that we have 12 to 15-year-olds that are going to be able to get the Pfizer vaccine, and Pfizer is anticipating that we will have the data for 2-year-olds to 11-year-olds by September, which is a great time frame because we'll be getting schools back online by then. So these are important opportunities for us to extend coverage throughout the US population. Now, another thing that we have wanted to know is not only are the vaccines working in real life, but there was a lot of question of whether these vaccines were starting to reduce the asymptomatic spread of COVID-19. So people early on wondered, okay, yes, we're seeing a reduction in hospitalizations, and yes, we're seeing a reduction in serious disease, but are we reducing asymptomatic spread and the ability of a vaccinated person to spread it to someone else? And now we've even got data that that's true. The numbers of cases of asymptomatic COVID-19 in vaccinated people is really quite low. So those are all really important findings that have been generated after having 4 to 5 months of data of having these vaccines reduced. And you can tell we're starting to see a drop in the numbers of cases in all the states. We're seeing a drop in the number of hospitalizations. And that's really gratifying to see for those of us that have been working on these vaccines. You have also been hearing a lot about virus variants that are spreading around the world. You hear about the Brazilian strain or the South African strain or the UK strain. The good news is we're getting data from a lot of these different countries, as well as the United States, that are showing that our vaccines may have a little bit of a drop in efficacy for some of these complex variants, but the vaccines are still preventing severe disease almost completely and are completely protecting people from death. And that drop in efficacy has been pretty modest. So that's been really encouraging. I still think there is that concept that we do have a race between trying to get people vaccinated and the virus doing what it normally does, which is generate these mutations and variants that challenge our vaccines. And because we are in that race, I think today's event is really important for us to really focus on how we can encourage people to continue to go out and get vaccinated if they haven't taken the opportunity to get vaccinated to date. So I'm going to stop there, and then we'll have lots of time for questions and answers where we can talk about some of the specific questions you have. But it's a really good time now, and I'm pretty encouraged by seeing the flattening of the curves that we've been seeing around Iowa and the rest of the country.
Thank you, Dr. Winokur. Next up, we're going to hear from representatives from the business community. And so first we have Rachel Geinfeld, who is External Relations Manager for Sukup Manufacturing Company. They're located in Sheffield, Iowa, and they manufacture grain storage, grain drying, and handling equipment. If you drive around Iowa, you for sure have seen their grain bins. They also make steel buildings. She's worked there since 2017, and she's a University of Iowa alum, got her JD and MBA from the University of Iowa. Go Hawkeyes. But I'll let you in on a little secret. She's actually coming to you from Ames currently. So Rachel, I'll let you go ahead and let us know what you all have been up to.
Yes, thanks, Natasha. I'd also like to add my undergraduate degree is from Iowa State. So thanks for letting me be part of the panel today. As Natasha mentioned, I work for Sukup Manufacturing. That was a pretty complete description of what we do. We're a manufacturing company. We have about 700 employees. We're located in Sheffield, Iowa, which is a rural community with a population of about 1,200 in north central Iowa. And part of my role at Sukup currently is to lead our COVID response team. So I just wanted to tell you a little bit about some of the COVID mitigation tools that we've used, and also some of our strategies we've used as we've shifted into the vaccination period. Early on, back in March of 2020, manufacturing was classified as essential workforce. And, certainly with 85% of our employees working on the production side of the company, we did have an essential need for them to come to work, to come to a location. We also, of course, with our manufacturing facility, operate on a shift schedule. So, hundreds of people are coming to clock into work at the same time. So we really did have some challenges based on the nature of our work in manufacturing. One of the first things we did was establish the response team, which includes members from all parts of the company, both the production side and the professional office staff side, to really address, how do we deal with this new environment? And we used to meet every day. Now we're down to meeting once a week. We still, certainly have plenty of things to discuss as a COVID response team. But one thing we really emphasized from the beginning was communication. One thing that we committed to doing was anytime there was a positive case confirmed of COVID-19, we would send a text message to our entire employee base, letting them know what building that positive case took place in. And sort of a creative approach that we took also was to distribute a packet of 3 bracelets to every employee, red, yellow, and green. And so the employees could choose to wear one based on their comfort level with in-person interactions. So for example, if you had a pre-existing condition and you wanted to be particularly cautious about your interactions with others, you could put on that red bracelet and there would be a nonverbal indicator to all of your coworkers around you. Please keep your distance. Please be extra careful around me. And so that was a great way to be able to share and communicate that information without having to, verbally say it every time. Of course, we work in a manufacturing plant, so it's loud in there. And, sometimes with communication, you have to get up close to people to really hear them. So that was something we thought was helpful to allow for more social distancing in our plant. And one thing we've shifted to now with the vaccines is I'm actually wearing mine today. We have an orange bracelet you can wear. So if you are fully vaccinated, you turn in your proof of vaccination and you can choose to wear this orange bracelet. And so that's a nonverbal signal to people around you that I am fully vaccinated. If you are in an in-person meeting with other individuals who are fully vaccinated, then we know that we all are, in that category. And so just having a quick, easy way to communicate to those around us that we have a vaccination and that we can have, certain levels of interaction. So that that communication has been really important. One other thing I wanted to just mention briefly was, we work in the agriculture industry. It's a very legacy industry. It's a relationship-based industry. And so we've really built a culture around those industries. We're also family owned and operated, so that's really informed our culture. And we've had to really think about how to shift some of the things that we just take for granted. One example I'll give you is every Sukup employee receives a frozen turkey every Thanksgiving. And the way we normally do it is everybody gets into 6 big lines. We're all in, one building and we go through these lines and get our turkey. It's handed to them by a member of the Sukup family. So this year we had to put a table in every building, have a Sukup family member go to each building and hand out the turkeys just alone. We tried to keep people within their buildings and try not to expose people to a lot of other individuals across the company. So those were some, kind of simple things we had to really think about. We've had these traditions at our company for decades, and, when a public health emergency supersedes some of those traditions, we had to think about how to shift our mindset. So now that we're moving into the vaccination stage, we are offering a gift card to employees who share that they have proof of vaccination. In addition to your orange bracelet, you also get that when you share your proof. And, just continuing to think about some incentives. We do have a pretty high percentage of our employees vaccinated that we have kept track of. We ask them to voluntarily share that information with our HR team. And so they have kept a dashboard showing what percentage of our employees are vaccinated. So that's something we're continuing to monitor. And we do have a metrics-based approach to some of our protocols. For example, we usually have picnic tables sitting out for people to eat lunch on. And so we recently, when we hit a certain level of our employees being vaccinated, we decided we could put the picnic tables back out. And of course, the CDC also provided guidance that, some outdoor interaction was safe when people are fully vaccinated. So those are some of the things we've been doing at Sukup Manufacturing, and I look forward to hearing from the other folks on the panel. Thanks, Natasha.
Thank you, Rachel. I love the bracelets and picnic tables as incentives. That sounds healthy and fun. Next, we're going to hear from Naftali Stramer. He's the owner of Oasis Falafel here in Iowa City. He's co-owned the restaurant that serves authentic Mediterranean cuisine since 2004. And previously, he worked in the tech industry as a computer engineer and executive. So very excited to hear what you have to say.
Hi, everybody. As you heard, my name is Naftali Sturm. I'm co-owner of Oasis Falafel. We are in business since 2004, downtown Iowa City. COVID, yeah, it hit us in March of 2020 like everybody else, and we had to shut down the restaurant by order of the federal government and the state government. And furlough all of our employees. We had about 35 of them. We also have about 4 small coffee shops at the University of Iowa and the University of Iowa Hospital and Clinics. And of course, the University of Iowa, the College of Public Health Cafe and the Art Building Cafe immediately were shut down. The one at the hospital stayed on. So when we reopened, and somewhere the end of June, two mainly, worried we had. There's one is who is coming back to work, how do we protect them, and how do we protect the public? Now we are a restaurant. The good thing about restaurants, we know how to wash hands and we work with gloves. But we don't work with masks and we don't use, we have sanitizers, but not those hand sanitizers. So when we came back, we had to do all those mitigation, but the main challenge was who are we bringing back? And we brought back only one shift of employees that will only work for open 3 days a week because we couldn't get more than those. And the people who we brought back were people that we knew that, we have a lot of young staff and everybody, but with people that we knew that are worried about their health and they want to stay home, not going to bars or meet with a lot of other people. Some were married. And we brought them back. And as I said, we only opened the restaurant for 3 days, plus 2 more days for doing prep, for the public. And this thing proved itself because until now we didn't. Since we opened in June 2020, we didn't have to shut down the restaurant because one of the staff got sick with COVID and gave it to others or not, or was exposed. We only had one exposure to the outside, but it came up to be okay with nobody got sick about this with us. So that was one main thing that we were worried about when we brought back the employees. And then the public, we shut down the inside of the restaurant again by government orders, but we are still shutting it down. And we created a service window for the restaurant so people can do pickup and people can order online and they can also order delivery with Chomp, which is an Iowa City company that is doing deliveries. So, and our front window was full with notices and signs saying, stay, please put a mask on when you talk to our customer, when you pick up your food. And we told the staff, if somebody's coming without a mask, politely ask him to put a mask. And we also said everywhere, including social media, if you don't follow our rules, we are sorry, but we cannot serve you. And we had a few people who were upset with us about this and gave us some bad names, but we wanted to protect employees. It was our first mission, and then the public, the second one. It's not easy to sit outside in the winter, in November, December, January, and wait for a falafel, and sometimes you have to wait for 10 or 20 minutes. Some people sit in the cars, but But people did it, and they were very supportive. People really wanted to support local businesses, so that's really helped. And they came and bought from us. We went through the winter pretty good. And then vaccination came out, and we really wanted that. We were lucky. All of our employees wanted to get vaccinated. Nobody was saying no, and nobody was fighting. We had to force them. So which was good. It's not the same in other places, but the main challenge was getting a vaccine. And actually, my co-owners actually went to Illinois to get a vaccine, and one of my other managers had to go to Burlington, Iowa, to get a vaccine. The others got him in Iowa City, but we didn't have any problem with this. We didn't need to give them an incentive. Their incentive was to stay healthy, and they wanted to be vaccinated. And unfortunately, when they got vaccinated and didn't feel well. And they all went in the same time, like 4 of them went at the same time to get a vaccine. We had to shut down the restaurant for a couple of days because they were not feeling well. But then it disappeared and they all came back. Now they're all vaccinated, but we're still working inside, everybody with a mask, trying to stay away from each other if they can. And we'll continue like this until the CDC or other places saying that it's already safe not to do this. For now, they got used to it, and that's how we work. But I do know other businesses that have issues with vaccination, and they give incentives. Some of them are. I heard this morning some company owners is offering up to $250 for his employees. He has like 200 employees, and only about 20% wanted to be vaccinated. So he offered us. There's a restaurant owner in New York, in Washington, D.C., I think, that offered $50 gift certificate to his restaurant to everybody who will get vaccinated, not even his employees, until 70% of the population of the United States will get vaccinated. That's a lot of money. But he cares about this. He wants people to come in and be safe and not infect his employees, so they have to shut down. So this is the challenges we went through in about 5 minutes. I'm going to stay here. Any questions that you want from me, please let me know.
Thank you so much for sharing. Our final panelist will be Dr. Mark Vander. He is a professor and head of the Department of Community and Behavioral Health at the University of Iowa College of Public Health. He's trained as a clinical health psychologist, and his primary research interests are in promoting health behavior change. Dr. Vander, you're next.
Hi, thank you very much, Natasha. I'm just delighted to be here and to be joining my fellow panelists. I'm going to talk a little bit about communication strategies and other things we might do to motivate folks to get vaccinated. And really, a lot of the things that I'd like to emphasize were so nicely, raised and talked about by my fellow panelists. So I'd like to kind of circle back to some of those things that they're doing that I think are so critical. And we've done a lot of work to try to figure out what's the best strategy for us to try to communicate with folks and motivate them to want to get the vaccine. And it probably won't surprise you that that message differs from person to person. What matters or what resonates with one individual doesn't necessarily impact another. But having said that, there are a few things that are critically important that seem to be messages or information that a lot of people find very important and very helpful. And a lot of that's been mentioned earlier, and I'll just sort of emphasize that again. And one, to go back to some of Dr. Winokur's comments, we know clearly the vaccine is very, very effective. And that is absolutely clear. And whereas there were some concerns perhaps about that among the public early on, I think there's no question, or there should be no question about the effectiveness. It's also been remarkably and rigorously tested. Although there were concerns that it might be so-called sort of rushed to use, the amount of testing and rigorous evaluation that has gone into these vaccines and testing them is remarkable. And it's very, very safe. again, Dr. Winokur emphasized this, but it is something that still we do hear of folks having some remaining concerns about those issues. So we want to make sure that those are the kinds of things that a lot of people still need to hear about the vaccine. And another thing that resonates a lot is that getting the vaccine will help us get back to valued activities and seeing the people we care about. And so I really, really like to hear the example that Rachel gave of, one of the things that once they reached a certain level of vaccination at Sukup, they would bring back out the picnic tables and that folks could go back outside and see one another in that valued social way. Those are kinds of things that are, one way they're incentives, and there also are ways for us to get back to doing the things that we want to do. And that's what motivates so many of us. So those are things to keep in mind. In addition to those, there's some more, I'd say, practical considerations that also can really make a difference in whether or not people make a decision to get vaccinated. And, simply stated, the more easy we can make it for folks, the more convenient, not surprisingly, the more likely they're going to want to get vaccinated and they'll opt to do so. So being flexible in your policies can be really helpful. To the extent that you can, offering folks paid time off to get the vaccine can make a huge difference. What we don't want is for people having to make a decision between working or getting the vaccine. And some people have felt like they're in that position. So we don't want them to have to do that. So offering paid time off to get it can be a really powerful incentive, but also a message about the importance of the vaccine. Side effects tend to be quite minimal, and Dr. Winokur certainly could talk to that very well. Some people do experience some side effects. They tend to be temporary and they tend to be short term, but some people have worried that if they get side effects, they might not be able to work. And again, so that's something that has served as a barrier to some people for getting the vaccine. So having policies that allow your employees to take time off should they need to for vaccine-related side effects. Again, the side effects tend to be minimal and they tend to be short-term, but most important probably is for folks to know that if they do experience some sort of side effects, knowing that they can take that time off can be an important motivator, or rather reduce a barrier to them for getting the vaccine. So that's something to keep in mind. It's also critical to be able to tell folks and provide helpful information about where and when they can get the vaccine. So as Naftali mentioned earlier, for a while the challenge was getting the vaccine to folks, and fortunately the access is much, much better now than it was for quite some time. But still, folks have questions. Where can I go? Where is it available to me? And so making that information available to folks and communicating that to them regularly can be a helpful strategy. And related to that is travel. Some folks have barriers with regard to traveling to get the vaccine. So if there are things that you can do, that your company can do to reduce those barriers and to provide that travel, that can be a very important consideration. As it turns out today, the White House announced that they're partnering with Lyft and Uber to provide transportation. And the details still need to be worked out, but there's going to be that mechanism for folks to get travel to and from vaccination sites. And so another barrier that we oftentimes hear folks talking about is cost and insurance status. So is it going to cost me anything? And the answer to that is no. And so folks, it's important for them to know, and it's a question that they might have for you, is how much is this going to, how much am I going to be charged? And folks won't be charged anything. Iowans can get the vaccine free of charge, as they can residents of other states. They also don't need insurance to get the vaccine. And that's been something that people have unfortunately got some misinformation about. So you do not need to have insurance, and you do not need to pay for it. Some vaccine providers will charge an insurance provider not for the vaccine, but for the administration. But that does not come back to the employee, and they will not have to pay for that out of pocket. So those are some important things that are more practical and more logistically oriented, but they're things that are serving as barriers to some people for getting the vaccine. And incentives is another. So, this is something that was mentioned earlier. Rachel had mentioned, incentives that they're giving in terms of the gift card. That can be a very powerful incentive. Naftali also mentioned, what he's heard about some other companies providing incentives. And, being able to do that can really go a long ways. And it certainly, you may not be able to provide the $250 to all of your employees. And I don't think the amount is necessarily what's so important as having some sort of form of incentive, but also the message that conveys, that this is important and that we're going to invest in you as our employees and we're going to invest in your health. And I think that's an important message to convey. And then, something else that really came clear to me in Rachel and Naftali's presentations was, the role that you all as employers can do in communicating the value that your employees have to you and their health has to you. And there were great examples of that from Naftali. Employees wanted to get the vaccine, and so they were shut down temporarily to get the vaccine. That sends a very powerful message, and that is something that really says a lot to the employees about how important this is and how important you value them and your health. Similarly, Rachel gave great examples of the things that Sukup is doing for their employees, to show how important that this is and how important their employees are. And so doing these things and showing as leaders, as employers, that this is important, and leading by example can go a long ways towards encouraging your employees. So those are some things that I'd just like to emphasize, and I was really delighted to see that folks are already doing here. So at this time, I'll turn it back to Natoshia, and we'll be happy to take questions.
Thank you so much, Mark. So thank you to all the panelists. If you want to make yourself visible again by the magic of Zoom, we'll take questions from the audience. Again, remember, you can use that Q&A button at the bottom of Zoom to go ahead and send us your questions. And we already have some. So I think the first one's going to go to you, Dr. Winokur, and it relates to this idea of the FDA approval for the vaccine. So if you want to explain a little bit about what that approval process means, why they use the word emergency, and is that word ever going to go away? Because it does seem to be a trigger word.
So it's a great question. And when we approve a drug under emergency use authorization, FDA has the legal right to make an early decision on a drug if there's a public health emergency, like a pandemic. And for a vaccine, what they said was they required the companies to show 2 months of data. And that 2 months was chosen very specifically because in vaccines, we often see some of these unusual side effects that are usually immune mediated at about 6 weeks after the vaccine, somewhere between the day after to 6 weeks. So that was why they chose that 2 months. Johnson & Johnson, Moderna, and Pfizer all passed that 2-month mark, submitted their data to the FDA. Full approval typically takes 6 months of data. And Pfizer is in the process of submitting that data right this very moment to get complete and full FDA approval. So we're close to having full approval for Pfizer. Moderna is going to be fairly close behind Pfizer. And I think that will help a little bit. Now we have also, in addition to the clinical trials where people have been followed really carefully for 6 months, you have again hundreds of millions of people that have gotten dosed with this vaccine. And that adds a tremendous amount to understanding the safety of the vaccines.
Thanks. And another one for you, fast-tracked or rushed, a bit. Those are also, I mean, you mentioned that briefly before. Could you explain a little bit about why this seemed fast or why it was fast-tracked and how that's not really related to the safety or the science?
Yeah, so I think this is where, that whole term Operation Warp Speed kind of took people. Yes, it was a rallying cry. It made us feel good that the companies were working fast to get this vaccine, but then it generated a lot of angst because people thought we skipped steps. And I can tell you, I've been in the vaccine testing world for quite a number of years. A lot of the background of getting a vaccine is done in the laboratory. It's really understanding the virus, it's testing things in animals, really trying to understand what parts of the virus are important for putting into a vaccine. And we were lucky, and I use that word very kind of carefully. There was one silver lining to this pandemic, and that was we had a little bit of a heads up in 2002 when there was another coronavirus, that was the SARS coronavirus, that was identified in Asia and even Canada. In 2012, there was yet a second coronavirus, the Middle Eastern Respiratory Syndrome virus. These two coronaviruses were really scaring the public health officials and a lot of people that saw how rapidly, especially SARS, could be passed person to person. We were lucky in the sense that they were able to lock down the hospitals, and the individuals who had SARS were really isolated very quickly. And we just by the hair of our chinny chin chin avoided a pandemic in 2002. But because those viruses were so scary, the scientists got to work trying to understand what about coronaviruses was so important for creating a vaccine. And they got to the point of actually creating vaccines that were tested in animals. So when the COVID-19 virus was identified in December, we had a lot of understanding of what we needed to do, and they could go straight into animal studies with sample vaccines and test them very quickly. And they could use a lot of the information that we understood from the SARS and MERS viruses. So that jump-started a very important and time-consuming part of vaccine development. The other thing that happened that was lucky was we had been working on developing new vaccine strategies and platforms for about the past 15 to 20 years. We knew that we needed to improve our vaccine production capacities and how we make vaccines. And so again, we were able to capitalize on that. And these vaccines are a new strategy. They're the messenger RNA vaccines or the adenovirus vaccines. But they really have had a lot of testing that's been done in the laboratory, in animals, and even in humans. So when people say we skipped steps, we really didn't. We took advantage of a lot of work that's been going on for the past 20 years. And that helped us. The studies were huge. Normally we test about 1,000 to 3,000 people with a new drug. Remember, each of these vaccines was tested in 30 to 40,000 people. And there were a couple of reasons for that. One is we knew we were going to be trying to approve these a little bit more quickly, but also we wanted to test them in a real life situation. Did they actually prevent infection? And so you needed those large numbers. So I think we got there quickly, but we didn't skip a lot of the safety steps that people worry that we skipped.
Thank you. I think that's very helpful and reassuring. To turn to our business leaders, could you talk about what was kind of the most challenging thing when you went to go implement some of your practices or policies around vaccination, and then not to be too gloomy, maybe something that was surprising or happy that you were excited about? Rachel, maybe you want to go first?
Sure. Well, I think a lot of employers employers probably had some challenges around sharing information. And I think someone alluded to, certainly there were some challenges just with access to the vaccine, especially earlier on. So a couple of the strategies we used were we posted information provided by the CDC in multiple languages around our facility, just to try to get the information out there. This was like well before anybody was getting a vaccine. So we hoped, to be an early messenger there. And then we also, we're very fortunate at Sukup. We have an on-site health clinic for our employees. So we were able to get 100 doses of Moderna vaccine, and those were available for our employees to sign up. We had all 100 taken. And then later on, we were able to coordinate with Hy-Vee to get a mass vaccination site at our facility. And that was available to employees, their family members, the community, and some other people, I would say, in our business orbit, some vendors we work with, dealers, et cetera, some other folks. So we were really, I think, fortunate to have that access. And one thing I mentioned earlier was we really focused on communication. So we also implemented a keyword text. So if you wanted to have someone from HR reach out to you to help you find an appointment, you could just text the word vaccine to a phone number, and somebody, you can do it without sharing it with your other, coworkers, and someone from HR would reach out to you individually and just walk you through where can I find, a vaccine appointment nearby. So those were some of the things we tried to do to implement or to overcome some of those challenges. I think Natasha was the second part. What was something that was surprising?
Yeah, like a positive thing. I hate to, we've had enough doom and gloom in the last year. Something that was surprising or positive.
Mm-hmm. Sure. I don't know. I think, like probably many people, we did sometimes tend to see some spikes in positive rates, following holidays where there would typically be a lot of gatherings. So one thing we did to try to get ahead of that is we have a professional cleaning service come and just clean the entire facility, sanitize it with a fog. So I think, we really had to, in some cases, like look in the rear view mirror and see some patterns, and then try to address those proactively moving forward. So I think we've learned a lot. I mean, one thing that's been so incredible is just how much you have to absorb and how quickly things change when, the state will put out guidance, the CDC will put out guidance. We're just learning more about the way the virus moves, just, vaccines being more available. So I think just trying to be nimble and, address those things somewhat in real time has been, it's been a learning experience, I think, but something that we've, I think, tried to navigate as well as we can.
For us, the challenges from the beginning was, who is this enemy that we're fighting against? What are we, it's like, the problem is that people to people became like basically enemies. They go, stay away because I don't want you to infect me, even though I'm not sick, or yes or no. This was more like a situation that the people had to get used to this strange thing suddenly that was fall upon us. So that was the first challenge, especially in a restaurant when you even if with no customers inside. This is the limit. Our kitchen is like 800 square foot. You need to work next to each other. How far are you working next to each other? The beginning was like people get close to each other, so stay away. And slowly they got used to it and understood what it is that we are fighting against. One thing we had to go with our employees and teach them is that, again, this weird world enemy is your customer outside. He's not your enemy. He's a customer, even if he comes close to you. So if you feel uncomfortable, stay there. Ask them to stay away a little bit, or ask them. That was like one of the big challenges is education. The second one was communication between the employees. That, hey, if you're sick, if you don't feel well, let us know. Even if it's not COVID, you need to let us know, because 11 other people are depending on you. If you are infecting them, they'll all go home. So that was another thing we had to teach them, and it works fine. You know, they communicated. We have 2 general managers that were great about communicating to us owners. Hey, this guy is not feeling well. It's not COVID, but we don't want him to be here. Or this lady was exposed, or thinks she was exposed. So we want her to be out for about a week and a half. And can you owners come in and work for them? And we did. You know, we had to come in and do a lot of shifts because of this. More my business partner than I am. But so that was the challenge. The surprise, the good thing out of it is that we basically became a family. Everybody is taking care of everybody else, and this is really, even up to today, it was shown that it works like this, and it will stay. It will stay like this. That's not even a question.
Yeah, I appreciate you mentioning that. Yeah, the virus that were inside of people, that was the enemy, but the people became the enemy.
Yeah.
Good point. We have another question to keep you both on the hot seat again. So this is relating to whether employees who are vaccinated versus not are vaccinated, are they treated any differently? For example, when you brought the picnic tables back out, does everybody get to sit at the picnic tables, or only folks with the orange wristband? And then maybe even thinking about, like, as you get new employees, how are you going to handle their vaccination status and things like that? So if you'd both speak to that.
Sure. Well, so far our approach has been very voluntary. People can submit their proof of vaccination and get the bracelet to have that nonverbal communication. We haven't really made any distinction between vaccinated versus non-vaccinated, other than if you are in a meeting room that allows for social distancing and everyone in the meeting has been fully vaccinated, then you can remove a face covering. That's really the only way we've treated those employees differently. One thing we have been trying to be very careful about was to disincentivize reporting. When we were talking about our metrics-based approach to bringing back some of the, I guess I should say relaxing some of the safety protocols, one thing we considered was if we have gone a certain period of time, like 2 weeks, without having a positive case. But we ended up deciding not to articulate that as a metric because we were afraid people wouldn't report it. You know, who wants to be the one who's like, the reason we can't have our picnic tables back? So we, did try to think about some of those things as well.
We don't have this issue. As I said, all of our employees for now are vaccinated, including us, the owners. The thing is that we're starting to hire again, or to increase. We want to expand back to 5 and maybe 7 days a week of operation, and we wanted to get more new people in, or even the other employees that were furloughed. And I asked, like so many places, legal and others, what can I ask and what I'm not supposed to ask? And there's so many, opinions out there that I just decided we will ask. And if people want to come back, we're not like saying you have to get vaccinated, but we ask, are you vaccinated? Do you plan on getting it? It's not like a condition of bringing you back, but we want to know. We know that for there's religious and medical things that people can say, I cannot get vaccinated. But so we do ask, and we hope that those guys who wants to come back, or ladies, are vaccinated or will get vaccinated. Until now, we're talking about 2 or 3 people coming back, and they are all vaccinated. So again, we don't have this issue. On another subject, we talked before about incentives and time offs and everything. Just as much as I know, for employers to know that if they're giving their employees paid time off because they got sick, because they took the vaccine and they have side effects for a couple of days, the federal government, you can claim credit on your employment taxes. So that's good to know, because if you do it, then at least somebody is paying it back to you. So not a lot of employees know about this, and there's not a lot of publications about this, but it is out there, and if you're filing your 941, employer taxes every quarter, it's there. It's asking you, did you use sick days for employees because of COVID? So that's what we know.
Thank you. That is super helpful. Rachel, what about you with Sukup and new employees? Will they be? Have you talked about asking them, or what will happen as new people are hired?
Sure. Yeah, it's interesting you bring that up. We actually just recently acquired a competitor, so they're all new Sukup employees. And on top of that, we've hired 105 new employees this year. We have 30 interns starting this month, and we could hire about 75 more this year. So we are, in a hiring period right now. We are certainly not requiring new hires to have a vaccination. We are really sticking to that voluntary disclosure policy. One challenge that we had was with our acquisition. There were 40 employees there, and they had, I will say, different standards about health and safety protocols than we had at our main plant. So reconciling some of those differences is, still part of an ongoing training process. And I think, a lot of that is cultural and just communicating expectations and, communicating the value. Why do we have some of these protocols in place? And, we know it's different from your previous environment, but this is why, it's important to us.
Thank you. And we did actually reach out to the to faculty in the College of Law to get some clarification on whether vaccines can be required and whether you can ask and things like that. And it's a very complicated issue, so we do not have a simple answer for you, but we can put you in touch with folks who can provide you with a very complex answer, and might be something we'd want to have a future webinar about. How about thinking about either words of wisdom to the business community that's currently listening, or things you wish had gone differently, or mistakes that you made that you would like to caution others to not make? So thinking about what you would tell one of your colleagues at a different business. You can go ahead, Rachel. Looks like you were about to say something.
Yeah, I guess I'll go ahead. It has been, I think I mentioned earlier, such a learning experience. None of us, I think, had the professional training on how to navigate a pandemic. I know particularly myself, navigating a pandemic through a manufacturing facility was, learning something new every day. And I think we really had to learn how to be flexible. I think we're really fortunate because we're a family-owned company, so the decision-making process is fairly nimble, and we can quickly change policies. We can quickly implement decisions. I would sometimes say maybe too quickly. We can, decide we're going to move forward with something and it's happening the next day. And sometimes, those things take infrastructure and it has to stand up pretty quickly. So I think that really just that flexibility was important. We made a very concerted effort to tie some of our mitigation strategies and our reopening strategies to Iowa and CDC guidance. And so, those are being updated constantly, and keeping up with some of those updates, is always a challenge. But I think just having a group on our response team who came from all different facets of the company was really valuable. We had people from our production side, we had our lawyers. I handle a lot of our PR and lobbying. So just, a variety of perspectives to make sure that every viewpoint was represented and that decisions were being made. Our team is 11 people. So, we feel pretty good about those decisions being made in a way that represents every employee, hopefully in a way that's meaningful. So just, I think that commitment to flexibility was probably the number one thing we learned. And, we hope we won't go through another pandemic like this, but I think we'll be much more prepared.
For us, for me at least, it was, again, the communication is like this number one thing. If I can give advice to someone, it's like communicate with your employees as much as you can. We decided from the beginning, my co-owners and I, that, okay, we were open from 2004. We successful restaurant, we have the cash, the government is helping. So we told our employees, don't worry about this. yeah, it looks like we're losing money, and we are. But we will be here. We will stay here as much as possible. You know, do whatever you can to help, and we try to communicate this to our employees, and it helps. And I think it's, don't hide things. You know, put it on the table. And I know other restaurants in town did the same thing. You have to shut down, but for a few days, and you open for the other few days, and communicate it to the employees. That was, for me, it was the number one thing, and the number one advice that I can give people. So.
Dr. Winokur, I know needs to leave. Is there parting words of wisdom or some hopeful note you'd like to leave us on?
You know, I think the hopeful part is we are really seeing improvements in the kind of curve, and a lot of people have chosen to get this vaccine. And everybody has had to be very nimble during this time, and I appreciate that significantly. In the healthcare setting, we have been standing up new wards, standing down wards, trying new practices. It's the same thing for us, but I think there are many things that have gone really well, and I applaud the businesses for all that they've done, and for the employees for stepping up and taking the opportunities to keep themselves and everybody else as safe as they can. It's been a remarkable time.
Thank you very much. Thank you for participating. Mark, do you have any final words of either do's or don'ts from the scientific literature around communicating about vaccine and vaccine hesitancy?
I think the most thing is just, you know, it's already, again, been nicely stated by my fellow panelists. Be open, be honest, talk to them, let them know, and pay attention to what new information is out there. But the good news is, as Dr. Winokur said, we are seeing an impact, and keep going, keep persistent with it. There are still folks out there who haven't got vaccinated, but who will, and who we can encourage. So keep doing the things that you're doing.
Thank you so much. We are coming to an end for our time together today. You will receive an email that has the recording of this. And again, you're welcome to share that with others, and you'll receive some additional information from the Business Leadership Network as well. Thank you so much to the panelists. Thank you to the attendees. Everybody go out, make sure you're vaccinated, grab 10 people, take them to get vaccinated. And hopefully we'll all see each other soon in the same room, all vaccinated. Thank you.
Thanks for inviting us.
Thanks.
Bye-bye.